Welcome back to Sage Connections. I'm really excited for today's episode because this topic is truly my bread and butter, pelvic floor physical therapy. This is the work I do every single day, and it's something I'm deeply passionate about because of how much it can change someone's quality of life. Today, I'm joined by my good friend Natalia Avelar, who is also a pelvic floor physical therapist. Between the two of us, we've had so many conversations about pelvic health, pregnancy, postpartum recovery, and all of the questions people have but don't always feel comfortable asking out loud. Our goal today is to break this down in a way that feels approachable and real. What the pelvic floor actually is, what pelvic floor physical therapy looks like, and why so many people can benefit from it. Whether you're dealing with symptoms, currently pregnant or postpartum, or just want to better understand your body, this conversation is for you. Enjoy. So, for someone hearing the term for the first time, what exactly is pelvic floor physical therapy and what role does it play in the body?
So, I like to start off with educating on what the pelvic floor is in the first place because a lot of people come in with that question and they've done some Google searches, they've done some research on their own, but they don't have a really good grasp of what the pelvic floor is and why they were either referred by a doctor or why Google recommended that they seek out a pelvic floor PT. So, the pelvic floor is essentially a group of muscles, and it includes also fascia, the organs that those muscles are supporting, it includes ligaments. And so a lot of people either think of the pelvic floor as just the musculature or just like the bony aspects of the pelvis, but there's really so much more that goes into it. And so when we talk about pelvic floor physical therapy, we are looking at how this area, the muscles, the fascia, the organs that sit there, the encompassing muscles around that area, whether it's in the abdomen, in the back, around the hips, how all of these organ systems and muscular systems are working together. And when somebody's coming in and has concerns that are related to anything that is going on in this area, we want to look at this whole area that's encompassed in the musculature, the fascia, how everything's moving, how everything's coordinating. So it's when I talk about pelvic floor physical therapy, it's really honing in on a lot bigger of an area than most people think of when they just think of the pelvic floor.
Yeah, absolutely. And I didn't say this in the beginning, but I'm so excited to have this conversation finally because this is actually my bread and butter as well and yours. And so it's really nice to be able to kind of actually finally talk about the thing that you do every day.
Yes,
And I
thank
agree
you
with
for
you.
having me.
Yeah, I agree with you 100%. And I think what most people don't also understand is the fact that your pelvic floor is part of the core. Like
Yes.
it's a very important part of the core, and it's a part that is often um, neglected or even not ever thought about. And
Hmm.
so a lot of the work that we do is actually teaching people where the pelvic floor is and how it functions within the core and the body.
100%. Yep. And I like to be corny sometimes when I'm educating patients on this because I feel like it kind of decreases the like fear and anxiety and shame around it. I always like to say like, "Hey, have you heard of that song by The Police called Every it goes like every breath you take, every move you make." I'm like, "That's your pelvic floor." Just hopefully in a less creepy fashion as that song. That song didn't
Yeah.
date very well. But it's literally respond because it is part of your core. It is there for every movement we're making, every breath we're taking. And I like to go into a lot of the anatomy of how the interplay is between the pelvic floor, the diaphragm, the core muscles that we typically think of as the core, because there's just so much overlap there. And so I think once people get a better understanding of what it is that we're looking at in pelvic floor therapy, there's like this aha moment of like, oh, that's why this is impacting my symptoms.
Yeah. And so this is going to be sort of our global overview of pelvic floor physical therapy, but maybe in the future we'll get into some more specific topics, diagnoses, and things like that. So speaking of sort of the global overview, for someone that's never heard of pelvic floor physical therapy, like what do we do for the general
Yeah.
versus general physical
Physical
therapy,
therapy. Yeah.
outpatient orthopedics, let's.
Yeah, yeah. So, well, with general physical therapy, because sometimes I'll have people walk into the office and they've never even been in PT in the first place. So I like to ask, like, have you been to a physical therapy, appointment before, just so to kind of have an idea of if they understand some of the background. And then I like to delve into what pelvic floor, how pelvic floor PT differs. But I like to first go over the overlap because we're still physical therapists through and through. And so we have a really vast knowledge in orthopedics and musculoskeletal, the whole musculoskeletal system, right? We take a look at range of motion, we take a look at strength, coordination, functional mobility. But then when we are going to the realm of pelvic floor PT, we're looking at all of that, but then we're kind of zeroing in on this area that's literally the hub of where everything is happening for every movement we make and every breath we take. And so we're looking at those same parameters of range of motion, strength, coordination, but we're looking at the pelvic floor, the abdominal wall, the back muscles, the hip muscles, and we're kind of zeroing in because this is the area that has brought somebody in to see us because they're having pain or issues there.
Yeah, I think
And
that's a
so
huge.
there's still a lot of, oh, I'm sorry.
Yes. No, go ahead.
There's still so much overlap, but then I just like to think of like we start off at a like further away view, and then we're just kind of going in to see pick up on all the details.
Yeah, I think that's a huge misconception from a lot of uh, patients that come into my office is whether or not I treat anything but the pelvic floor. So they're
Mhm.
kind of like, I'm
That's
here
a
for
great point.
pelvic floor. And then maybe we get like a few sessions in and they say something like, "Do you know anyone who treats the knee because I'm having some issues there?"
Yes.
So I think there's a really big misconception that like we are outpatient orthopedic physical therapists.
Hmm.
First and foremost, that's what we were trained in. Pelvic floor physical therapy is the sort of specialization within that specialization. And we're still dealing with the same muscles, ligaments, fascia, like you were saying in the very beginning. It just happens to be in a very specific area that's very vulnerable and not
Yes.
everybody wants to treat. And that's why you have, certain people who are specialists in that. But overall, like it's all still muscle and ligaments and
Yes.
joint,
Yes.
like it's all the same stuff as in your knee and your quad and your hip and your shoulder. It's just in a different area, right?
I've had so many people ask me exactly that same question. Like, do you know somebody who can treat, my knee or my hip or my neck? Especially a lot of my postpartum patients, so much stuff is going on. There's been so many changes in their body. And so they come in maybe for pelvic floor PT because their doctor referred them or because they're like, I've heard a lot about this and that I should do this postpartum. But then other things start popping up because of all these changes that are going on in their body. And they're like, oh, like, do you know what I should do about my neck? I'm like, yeah, let's tackle that too. Like, your hip bone's connected to your knee bone. Like it's like the kids' song, right? And so we can look at the whole system. And so it's important for us to know what things are popping up for patients because we can treat them, even though our focus maybe initially is the pelvic floor, that is all connected and there's so much that we can change. I think, I worked in the hospital systems for a long time before starting Peace Pelvic Health. And I think part of the problem also is that the system has taught us to only concentrate on one body part at a time. And so we are only allowed in some of these bigger corporate systems to only work on one body part at a time because of insurance reasons. And so I think a lot of times, even physical therapists as well as patients kind of get stuck in this line of thought is like, okay, this person treats this body part and this person treats this body part. I can't see one person for both of those. And so I'm hoping that we are kind of fixing that healthcare gap and helping people find out that there's so much more that physical therapists can do and treat holistically.
Right. And I think that's why both you and I are cash-based physical therapists because we do understand that. I mean, we know that the pelvic floor and the cervical spine are connected. If you have overactivity in the pelvic floor, odds are you might have TMJ issues, you might have neck
Nick.
pain,
Yep.
and it all kind of relates to that stress response, that fight or flight, parasympathetic or sympathetic response where you're using that shallow breath throughout your
Mhm.
entire day, right? And so it really is all connected, and also your entire system is connected to the core, right? Like your stability, your shoulder stability is connected to your core.
Mhm.
Your ankle stability is connected to your core. Everything is
Yep.
connected to the core. And so it is kind of odd to just focus on like just the knee because right, like if a knee hurts, odds are we're looking at the hip, we're looking at the back, we're looking at the ankle, we're looking at the foot, we're looking at the
Hmm.
core.
Yep.
And
Yep.
same thing for the pelvic floor. Yes, the diagnoses are specific to the pelvic floor, such as incontinence, right? And pelvic pain and overactivity and sort of all these things. But it doesn't mean it those symptoms don't affect the rest of the body, or the symptoms in the rest of the body don't affect those symptoms.
Yeah, yeah. And going back to, how like if your shoulder or your knee or other body parts are hurting, um, I always, when I go back to the pelvic floor, because some people are like, well, what does that have to do with it? I like to go back into teaching like the four S's of the pelvic floor, because then I think there's this aha moment of also like, oh wow, the pelvic floor is doing so many things and I'm not even aware of it. So, stability is a big one, providing stability to the pelvis and to the spine. And so if you're having any pain above that level or below that level, and we're looking at somebody's posture, because that's what we're trained to do as musculoskeletal physical therapists, we are seeing like what is happening at this other area that has brought these other issues in, but how could that also be affecting the knee pain or the upper back pain or the neck pain, etc. And so stability is that one of those S's. And then I talk a lot about like the supportive functions of the pelvic floor, the sphincteric functions that I think most people, when they hear pelvic floor therapy, they think of just the sphincteric function, which is leakage, and or people experiencing leakage, having an issue with that. And so I like to point out like that's just 25% of it. And then the last function is sexual. So sexual for, orgasm, arousal, all that, and but also for childbirth. And so I think once we start talking about all those functions of the pelvic floor, then light bulbs start going off for a lot of people of like, oh wow, it really is involved in so much of what I'm doing day to day, whether it's sitting and how my posture is when I'm sitting at work, or whether it's how I'm standing as I'm, lifting the kids up, or how I'm exercising, etc. So I always like to kind of go into those four S's with people because I just think that it's really powerful to point out how much this small area and this area that we don't really see day to day is impacting what we're doing
That's
and the
awesome.
symptoms that come up.
So give me just real quick the four S's again. Stability.
Stability, so postural stability, right? And that's where we can go more into the core and some stuff that we were talking about earlier. Supportive, so for our pelvic organs in females, that's bladder, vagina and uterus, rectum. For males, it's bladder, prostate, and rectum. Um, Sexual, so arousal, orgasm, for females, childbirth, that all encompasses sexual function. And then lastly, what did I not mention for my last one? Sphincteric, the one that everybody knows about.
Perfect. Okay, perfect.
So sphincteric
So
for both bladder and bowel.
yeah. So okay, so with that, what are some of the most common symptoms or conditions that you see that bring people into pelvic floor PT?
So I would say the most common, I'll kind of lay it out in different realms of like what's happening in that area. But when it comes to bladder symptoms, we most often see and hear the first time somebody's calling in for pelvic floor PT is they're having concerns of leakage. And there's different types of leakage. So it could be like coughing, laughing, sneezing, or it could be more of an urgency issue. But I would say that that is still a very common thing because that's what also we're mostly known for, historically speaking. But your bladder symptoms can also include like frequency, urgency, hesitancy to start a stream of urine, recurrent UTIs. That's a big one. I always give my little PSA announcement because if you're having recurrent UTIs and antibiotics are not cutting it, like the pelvic floor has something to do with it. And so I'm very big into educating on that and giving that little PSA. But those are the main like bladder things that we see, bladder concerns that we see people walking in with. But then we have a lot of bowel concerns of constipation. We're a very constipated society. Our diets are not the best. So constipation, leakage also from bowel perspective, IBS type symptoms like abdominal pain, bloating, chronic, kind of belly issues. Sexual dysfunctions for a lot of females, it could be pain with sex, but it could also be for that sexual function, like I mentioned, like pregnancy and childbirth, postpartum care. There's a lot of things that come up during those specific pivotal times that starts to kind of filter into overlap of issues with bladder, bowel, maybe some pelvic pain, back pain, hip pain, etc. A big one I see, actually, speaking of back pain, is back pain. And so I always educate my patients that if your back is bothering you, or if your hip is bothering you, or we're anywhere in that pelvic territory, like we need to pay attention to what other um, signals the pelvic floor is giving us. And so I screen very thoroughly on what it is that can also be coming up for somebody else other than the back pain, if that's what's bringing them in. And back to our earlier discussion, I think when it comes to general and pelvic floor PT, I think where we are very well equipped as pelvic floor PTs is really screening more in depth. Whereas in general PT, like, your knee brought you in, we're going to look at your knee, maybe a little bit above and below, but that's it. In pelvic floor PT, you're coming in and you're like, my back hurts, my hip hurts. I'm feeling, sciatica symptoms. It's like I want to ask you all these other questions also because I know what's happening in that surrounding area. But those are some of, like, I would say, the more common symptoms and common presentations that we see in pelvic floor PT.
Yeah, and I think, you know, it is of note to just mention that by the time people do see a pelvic floor physical therapist, they've usually gone through what's the average, like 7 practitioners before they get to us.
Yeah,
Yeah.
yeah, that's a great
And
point. Thank you for bringing that up.
yeah, and then, I've had cases where somebody comes in sort of having hip pain, but coming in to see me specifically for, let's say, incontinence or something like
Mhm.
that. But once we actually assess the pelvic floor, we can actually address hip pain from an angle that you don't really have access to if you're just treating externally.
Yes.
Um, so yeah, it is it's amazing to be able to kind of look at sort of that. Sometimes it is kind of the missing link for a lot of other different things.
Yeah, yeah,
So
100%.
okay, so a lot of people are nervous or unsure about coming to pelvic floor PT. They hear all sorts of interesting things about what we do and how we do it. So what actually happens during a PT evaluation?
Okay. So yes, I agree with there's a little bit of nervousness and fear, especially for the first time coming in. And I'm just going to start with saying that once somebody's completed pelvic floor PT and they're feeling so much better, and a lot of times the thing that I hear is, I want to tell everybody to come in and do this. And I'm like, okay, I'm setting you free, Birdie. I'm like, please go spread the word so that it decreases the fear and I think some of the shame and anxiety around it. But to answer your question, so that first visit, that initial evaluation, I like to tell people it is still a conversation. It's a conversation about what is bringing you in. What are your concerns? When did these concerns start? How is this affecting you? Not just physically, but also emotionally, mentally. Like there's so much overlap. We have this biopsychosocial approach where we're looking at how everything is working together and affecting each other. Um, so that conversation leads eventually into the assessment, but that conversation can be very lengthy. It could be anywhere from half of that initial visit to the full visit. And it depends on, how complex of a history the person comes in presenting and how many providers they saw before they came to see me. If they have seen those 7 providers and they just kept getting tossed around, then that conversation is probably going to be pretty lengthy because I want to know what has worked and what has not worked. I don't want to waste my patient's time. I want them feeling better as soon as possible. So if I just cut straight into an assessment and I just have a general idea of what is bringing them in, what's causing them pain, then I am bypassing so much important information, and then I'm probably wasting time later on with treatment. So that first conversation is super, super important. And then I do a lot of thorough education on what it is that I'm hearing and what it is that I want to take a look at and what it is that I want to assess and why. I have a pelvic model in the clinic, so I'm very thorough about demonstrating like the anatomy and how everything's functioning together so that my patient understands that there is a reason why we're doing this. And I am feeling seen, I'm feeling heard, and I am being understood. And so I think that opens up the door to going into the assessment. And then I see just like this drop of the shoulders and this decrease in anxiety because it's like, wow, somebody finally understands what it is that I'm talking about. And so that initial assessment, it's still looking at what that general PT kind of session looks like we were talking about earlier. I'm taking a look at their range of motion, at their strength, at their coordination, how they're breathing. And then if they feel ready and comfortable, and I feel like it is warranted to do a pelvic floor assessment, we go forward and we decide on that together with the patient. So I just really, really like to emphasize like conversation is first and foremost. You want the patient to be seen, to be heard. And when they understand why we're doing what we're doing, it strips away a lot of that anxiety and fear or nervousness of what brought them in the first place.
Yeah. And also, let's just be direct about it. We are pelvic floor physical therapists because we are trained specifically to do an internal pelvic exam of the internal pelvic floor muscles. It is
Yes.
the best way for us to understand the function of your pelvic floor and any kind of muscular, I guess, dysfunction or overactivity, whatever it may be. And so that exam could happen on the first day. Usually for a lot of my patients, they're ready to go because I am so far down the totem pole in terms of,
Agreed.
you know,
Agreed.
yeah, and so they're ready to go. But for some, that's not appropriate on the first day. But the point is, it's very important that if you are seeking out a pelvic floor physical therapist, they have to be able to do an internal exam because if they cannot, that is like saying, I will treat your ankle from the waist up. Like
Yeah.
that, it does not work that way. I mean,
Yeah.
it could by some lovely miracle, but
Yeah.
most of the
Yeah.
time it does not. Like you want to be able to assess the ankle. You want to see someone stand. You want to see somebody in single leg balance. You might want to see them run, whatever it is, right? Same thing for the pelvic floor. If you're having pelvic floor issues, we want to see what the pelvic floor function is doing. And the best way to do that is with an internal exam. Now, there are other options, again, like for people that aren't comfortable, but that is a part of what we do. And, there is consent is the biggest, I guess, the biggest thing of what we do as well. So the patient is always in control. And I know, we went to the same school. Surprise everybody. We're old classmates, but we sort of, come from the same background from an education perspective. So I think we both probably practice in a very similar way. And so you were saying you bring out the model. I do as well. I explain the exam on the model first and foremost. And then I ask, sort of multiple times, and I explain the exam as we're going through it. So there's always, everything is in the patient's control from
Yep.
second one.
Yep.
And
Yep.
so
I
that,
always tell my patient, you're in the driver's seat.
Mhm.
I'm laying out the options and what we are able to do today to help end your suffering faster and so that we could get you feeling better. And again, especially if they've been already at a few providers and it's just not cutting it, or if they've been to general PT and it's not cutting it, it's like, if it's up to you, but if you feel like you want to get things rolling, like we can go forward with this. And so I would say 95% of the time people are ready to figure this out.
yeah. So hopefully that helps soothe some people's minds about what it actually consists of and
Yeah.
why we do what we do.
Yeah.
Okay,
For
so
female
yeah,
patients, I just like to like reassure them and let them know like this is a little different from a routine gynecologic exam, because a lot of people think like what is this exam going to look like, and all they have to compare to is a gynecologic exam, right? And so I like to do a lot of education with that because I'm like, no, this is very different,
right. We
and
don't
it's
have
going to feel very
speculums.
different. And so that usually also gives them quite a bit of calm.
Yeah, yeah. We don't use like speculums. We don't take tissue samples or anything like that.
Correct.
We
Yeah.
are specifically working with the muscles of the pelvic, well, muscles, ligament, fascia, scar tissue in some cases,
Yeah.
but specifically with that part of the pelvic floor. And, from my understanding, maybe I'm hoping this is changing, but from my understanding, we are the only healthcare professionals that are trained to check for pelvic floor function
That's my understanding as well. Yeah. And physical therapists and occupational therapists.
and occupational. Yes.
Yeah.
Okay. So speaking of scar tissue, I suppose. or all of these things. One of my favorite populations to treat is pregnancy and postpartum. Uh, and so, how, in your opinion, how do you think we help people through pregnancy and then actual, like preparing them for delivery and
Mhm.
then postpartum?
Yeah. So physical therapy during the time period of pregnancy is wonderful for many things. As we spoke earlier, like the pelvic floor is involved in posture, and posture changes so much during pregnancy, in a relatively short period of time. So things pop up for a pregnant individual, whether it's pain, whether it's, functional mobility issues. So we can address all of that as it's coming up. Some patients will come into physical therapy very early on in pregnancy before some of these changes start happening. And it's so wonderful to be able to see it from a proactive standpoint because as things are popping up and changing, we can help address them in the moment so that a patient's not suffering during their pregnancy. Sometimes people come in a little bit later and they are in those last few weeks of the pregnancy and they are miserable. And so we are trying to find those best pain management strategies or strategies for dealing with whatever functionally is going on, maybe from even a bladder or bowel perspective. But during pregnancy, the other really exciting thing that I've noticed in the last 5-ish years, maybe 5 to 7 years in our field, is there's a lot more people coming in proactively for birth preparation. And to me, that is such a win because it sets the patient up for so much success for labor and delivery. And then really it sets them up for success postpartum. And I like to emphasize that to patients because labor and delivery is one day. And yes, we want a successful, healthy, safe delivery for baby and for mom. But we once postpartum, always postpartum. And so that transition period, the more you know about your body, the more empowered you are to know how to catch things if things are popping up for you and to get the help that you need and deserve. And so pregnancy is, I think, a super pivotal time to work with a physical therapist because there's so much that can be addressed and there's so much that we can do proactively. But then transitioning into postpartum, which is where I think we still have a little bit of this healthcare gap of we may only see patients who already had something happen postpartum and they're at their 6-week appointment and they mention something or sometimes they don't mention anything and a doctor will be like, oh, maybe you should go and see a pelvic floor PT. Or some people don't even bring it up in those few short minutes in a 6-week follow-up and they kind of start Google searching themselves and they're like, maybe I should see somebody. Or they have a family or friend that said like you should probably talk to a pelvic floor PT, and I'm grateful that there are advocates out there for that. But postpartum, we can do so much to help with the healing process, whether it's a vaginal delivery, a cesarean delivery. There's a lot that goes into the core and the pelvic floor when it comes to both modes of delivery. And so I always say to my patients, regardless of mode of delivery, your pelvic floor is not completely spared and your core is not completely spared. So we want to learn how to work together, how to coordinate everything together for proper healing and then also for return to function, whatever that looks like for somebody. So, some of my postpartum patients, they just want to be able to be functional, pain-free, no leaking with childcare and with self-care and doing things around the house or going back to work and they're stressed out because they're leaking and they're like, how embarrassing is this going to be when I go back to work? But for some people, it's like, I want to get back to exercise. I want to get back to doing the things that will really make me feel good from a physical perspective, but also from a mental health perspective. So we can treat patients throughout that whole pivotal time period from early stages of pregnancy all the way to postpartum. Typically, when I do start seeing a patient earlier in their pregnancy, I am seeing them for a long time. And it is wonderful because you see how great they feel in their bodies and they are feeling heard and their concerns are being addressed as they're coming up. They're not living with the concerns for months, if not years, right? How many times have we seen patients come in years after something happening and they just like were put on the back burner, or maybe they put themselves on the back burner, or they just kept telling themselves, oh, this is normal. This is normal. It's because I had a baby. And so I really love to be able to see patients throughout that whole time period from pregnancy to postpartum because there's so much that we can do and my patient feels so much better. So it's really it's one of my favorite patient populations to work with as well.
Yeah. Yeah. And sometimes we don't see these people until they're like perimenopausal or menopausal. And they're just like, do you think this could have happened when I had my four kids? And, you know, uh,
Mhm.
so yeah, the sooner sort of if you are having symptoms, and even if you're not, I think everyone should know how their pelvic floor functions. And postpartum is, it's a stress on that part of the body. So like if you have knee surgery, you're automatically sent to PT. Even
Mhm.
if you had a mild, knee surgery, like a meniscectomy or something like that, right? And you're going to PT for a couple of weeks. But here you're not only your body's changing for 40 weeks, but you're also, could potentially be having this traumatic event. Even if it's
Mhm.
not traumatic, still stuff is happening. Stuff
Yeah.
that's not everyday stuff is happening.
Yeah. A lot
So
has happened in a short period of time is what I tell
very
everybody.
short period of time. And then on top of that, you're dealing with sleep deprivation on the other end of it. And we
Mhm.
know that sleep helps with recovery and um, you know, for anybody. So you're not even getting the proper sort of you don't have the opportunity for proper care postpartum
Yeah.
because you're losing out on that sleep. So it is a big deal, and I really wish that in our society we would make this sort of a no-brainer. Like you get pregnant, maybe you go see a PT. The other thing I wanted to mention, because I was going to say pregnancy, but is many of the women that come into my office with their first pregnancy, they don't understand what it means to push. And their pelvic floor, even if they think they do, their pelvic floor might not be listening to their
Mhm.
directions. So that's something
Yes.
we work on. And two, we talk about labor and delivery positions, which a lot of people don't know about either. They think they're just going to go to
100%.
the hospital, lay on their back, get a little stuff, maybe not get a little stuff, whatever, and then just have the baby. But there's actually more to it that you can do to help the process along for yourself and for
Yeah.
the baby.
Yeah.
So yeah, I think it's so valuable, to come to pelvic floor PT at that time in your life because not only does it set you up for a healthier pregnancy and a healthier postpartum journey, but it
Mhm.
also helps prevent some of the things that could happen during delivery into, when we start losing our estrogen in our perimenopausal, menopausal years as well.
Yeah.
So
I thank you for bringing up, birth prep and like the postural or like labor positions and how we can help patients prepare for that. I actually, about 2 years ago, I started teaching a pelvic floor birth prep class, and it's an adjunct class to childbirth education classes at this one facility near us. And I have to say, majority of the time, I jokingly say that it's kind of like a quick version of, 2 hour workshop. You get like all this information and then, you kind of go home and practice. Almost, I would say 90% of the time, patients want to come in for one-on-one discussion with figuring out what it is that their body's doing, what their pelvic floor is doing. Are they pushing properly? Because there's a lot of education in those 2 hours that I'm teaching, but there is a lot of information that's like, whoa, I don't know how my body's doing this though. And so it's really empowering, I think, for a lot of people to realize like I have actually some influence on how my labor and delivery can go.
absolutely
Um,
agency,
and
right?
one other really positive I want to say, just in the realm of PT for pregnancy and postpartum, is a shift that I've been hearing about more also is immediate acute care follow-up in post-delivery for patients that have had like a more severe tear or for cesarean deliveries. My hope is that everybody can get a pelvic floor PT into their hospital room or if they're at a birthing center before they go home, just to be able to answer some questions because there's a lot of things going on and some people are pretty scared when they're going home. So I think it would be really comforting for postpartum women to have access to that as well in the hospital. And so I'm starting to hear a little bit more about that in some of the hospital systems in Chicagoland area. And I'm hoping in other parts of the country and world as well.
I love it. Thank you for bringing that up. Thank you so much for being here. obviously could talk to you for a million years, but I think this will be such a helpful sort of conversation to for people that want to kind of dip their toe into this realm or maybe are curious if they are a candidate for pelvic floor PT. Hopefully, we kind of laid out the groundwork for that and answered some questions. But I will include all of our information in the show notes. So please feel free to reach out to us personally. I am in the Metro Detroit area in Farmington, and Natalia is in the Chicagoland area. So we are more than happy to help and you know bring bring this discipline to as many people as possible.
Yeah.
So
Thank you so much, Luba. It's so fun talking to you about our passion.
we will do it again.
Thank you.
Thank you so much to Natalia Avelar for joining me for this conversation. I loved getting to dive into this with her, especially because this work is such a big part of both of our lives. Pelvic health is something that affects so many people, yet it's still not talked about enough. My hope is that this episode helped bring more awareness, clarity, and reassurance that support is out there. If this episode resonated with you, share it with someone who could benefit from it. And don't forget to like, comment, and subscribe so we can continue growing this community. And as always, take care of your health and your wellness.